COVID-19 pandemic is adding extra stressors for hospital workers around the world. They're dealing with an IV contrast shortage, which is used for medical imaging tests.
Leaders at 2 health systems in Hampton Roads are feeling the impact. Casey Baylor explains how they say they're not letting another shortage get in the way of your care.
A global shortage has health leaders with Riverside Health System and Centera Healthcare making another pivot.
We're very used to, having to change course and figure out how to move forward.
Intravenous contrast solution, also known as IV contrast, is injected to enhance imaging tests, primarily in CT scans. Just a few weeks ago, both health systems learned of the shortage. Leaders say it's because GE Healthcare, one of the major suppliers of contrast media, had to shut down its major manufacturing plants in Shanghai due to the COVID lockdown.
Even since the restrictions have relaxed a bit, they're only able to bring in a small percentage of their staff,
which in turn produces a small amount of solution. Riverside Health System Vice President Cindy Williams says on average, the health system would receive 2 weeks worth of products twice a month. Now, health leaders are placing orders every week.
Last week, we got a very, very small supply, equivalent to about a 1 day's worth of supply. This week, we are scheduled to get what would be the equivalent of about a 5 days worth of supply.
Leaders say they immediately sat down with radiologists to develop a strategy to preserve vials, which includes using less solution or using an alternative imaging modality. The last thing they say they wanted to do is delay any procedure for its patients. And if one health system is in need of help, the other is ready to step in.
If there is ever a point where one system is short and there's a patient in the middle, a patient that needs care, then we will do whatever we have to do in coordination with the other system to ensure that those patients get the care that they need.
I'm Casey Baylor for 13 News Now.
Health leaders say GE Healthcare hopes to improve the amount of supply each week. By July, they don't expect to resolve the issue, but they hope to be in a better position than they are currently.